Hi, it's Rusty Jenkins again from Wasatch Physical Therapy in Layton, Utah. Today I wanted to talk to you about the benefits of dry needling for patients with shoulder pain. A lot of the times we'll have patients come in with chronic shoulder pain or acute shoulder pain and want to know what's going on. A lot of the times the patient complains of pain in the anterior portion of the shoulder, goes down into the bicep and tricep, and then kind of settles around the elbow. And we use dry needling a lot to try and help determine how much of that is actually a rotator cuff significant injury or just overuse or a strain. So wanted to show you specific muscles of the rotator cuff that we treat with dry needling. So here you can see the supraspinatus, which is one muscle of the rotator cuff. The muscle's here on your shoulder blade, and it sends and refers pain into your shoulder and down your arm. Teres minor is another muscle that we like to focus on, and you can see where that refers pain into the tricep area. Up here it shows a couple other muscles of the rotator cuff, your infraspinatus and your subscap. And again, you can see the different areas where those muscles will refer pain. And so we use the dry needling to try to see how much of this is coming from a muscle and how much we can change with the dry needling. So I'll show you that technique now. We have a patient that has had shoulder pain in the past, and this is another great way to try and help get the patient back to life and back to what they want to do. So as I put the patient through a detailed physical therapy evaluation to determine what's causing the problem, then we'll set them up and use the needling to see how they do. So clean the skin with some alcohol. And then with the evaluation, we would determine which muscles are the most painful and which ones need to be treated. So as I treat the muscle, what I'm looking for is a good twitch response and a bony backdrop with that shoulder blade so that it's a good safe technique with the needle. You can see I've needled her teres, her infraspinatus, her supraspinatus, and if I wanted to get the subscap, I would do that too. I'm just going to show you, we'll needle the deltoid. So that's a basic technique for shoulder pain. What I would also do is hook that up to some electrical stimulation to improve some input into the dysfunctional tissue, and then show them some exercises and see how they responded with that. Again, this is a great technique for patients that have shoulder pain, and our goal with the needling is to use it until we don't have to and get the patient back to life.